another study saying that a sleep complainant known as obstructive sleep apnea or OSA could now be a potential risk factor for a severe bout of COVID-19. Three smaller studies had previously found that the condition, which involves a person's breathing, stopping and starting with their sleep, was associated with hospitalization among those infected with COVID-19. I also have with me Dr. Richa Sareen from the Fortis Hospital, Vasant Kunj. Thank you so much for joining us. Dr. Richa, if you could give us some more details about how this really works, because there is a huge percentage of people who do have this sleeping disorder. Now, if you believe the study, it says that they are actually at an extreme risk of catching the COVID-19 virus.
So I would like to just correct it. It's not that they are at an increased risk of having COVID-19 infection. It is that they are at an increased risk of severity of COVID-19 infection. So that there is a basic mechanism behind this. What is obstructive sleep apnea? Obstructive sleep apnea is that during sleep, an obstruction to your airway is happening, which is causing reduction in your oxygen levels. We've seen in patients, sometimes the oxygen levels goes down to 30-40% also. This causes a chronic inflammatory state in the individuals, and it causes an oxidative stress. So this is also related to the severity of COVID, because the severity of COVID is also related to hypoxia, Can you hear me? Hello?
Absolutely. Please go ahead.
Yeah, sorry. So the severity of COVID is also related to hypoxemia. So what we call is happy hypoxia, that patients might not look so sick, but their oxygen levels are very low, which is again an indication for hospitalization. So this study is found out.
So just to simplify this for our viewers, and it's good that you pointed this out. What this study is saying, that if people with disorder contract COVID-19, the severity of COVID-19 would be severe for those patients. So Dr. Richa, what I'm trying to then understand is, because a lot of patients who have this actually wrote into us to try and understand that how can they actually safeguard themselves if they do have this sleeping disorder and they do get COVID-19, any special precautions that they should be taking?
So if people with OSA develop COVID-19, so they also become the high risk group, the people who should go and get admitted, and they should be monitored, because the issue with obstructive sleep apnea is that your oxygen falls when you sleep, and you cannot monitor it at home effectively. So like people who have diabetes, people who are cancer patients, people who are above 60 years of age, like that only people who have OSA, and if they contact COVID, they should also get hospitalized for better monitoring. This is what they should keep in mind, because in these people, the oxygen can go down to a lower level.
Okay. And then, of course, we do know that patients, when the oxygen level falls, they need hospitalization as well. And more patients would like, if they could just be home quarantined, and if it could be, made better just by being in home isolation and not actually having to visit a hospital. Now, Dr. Richa, I want to bring you back in. Now, this sleep disorder study that we're putting out is just one of the many studies, that researchers are really working on. Have you seen any, interesting pattern that have come off late in terms of any disorders that are related with COVID-19? Because we've seen how everything really depends on immunity. A lot of people who had comorbidities, they've actually ended up losing their lives when they contracted COVID-19. So disorders, are they fully related to COVID-19, and does that unfortunately lead to mortality rate as well?
So the two disorders which we are seeing very, very commonly in patients who have moderate to severe COVID requiring hospitalization, the topmost is diabetes mellitus. And in those also, people who have an uncontrolled diabetes, people who are not taking care of their diabetes previously, skipping medicines and all those things. And second is hypertension or blood pressure. So these are the two diseases which we are seeing very, very commonly. People who are suffering from either of the two diseases are landing up with the more severe form of COVID, requiring hospitalization. Sometimes they develop pneumonias. They are more prone to go into the cytokine storm. They are more prone to lose their lives. And one more set is the chronic kidney disease patients. These are the patients who've either had a kidney transplant done, they are post-transplant, or they have a malfunctioning kidneys and they're dialysis dependent. So these are this set of patients also are getting very severe form of the disease. So these are the few conditions that we are generally seeing who are having severe form of disease requiring ICU.
Okay, so this will be a good set of information for patients who already have diabetes or on dialysis, that of course, the risk of COVID-19 then also of course increases for them. Dr. Raghu and Dr. Richa, thank you so much for taking our time and joining us and helping us understand what these new studies really mean and how people can really protect themselves